So we are in the antrum, and you see this is the main pancreatic duct, which is communicating with the cyst. And the problem in this patient is that when we drain the cyst, the patient is going perfectly well. She has a disconnected duct, which is and a communication of the cyst with the tail, the body and tail of the pancreas. But the problem is the lack of stability of the stent. So at two times after drainage of a pseudocyst with a pigtail stent, the pigtail stent migrated. So here the problem is mainly to place a stent into the pancreatic duct or into the cystic cavity with the aim that it will stay in place. I have to be sure that I'm not going through a vessel, which seems to be the case. So I'm using a 19 gauge needle. I will fix it there, and then I will try to go to the collection. But you see, this is the typical problem we may have in chronic pancreatitis, is that it's quite very hard sometimes. And you see that I'm probably in a I'm not yet in the cyst, so no, I should be in. And then I will try to push a little bit more to go inside. No, I'm inside, you see. And then I will ask Ute to remove the stylet. I have a certain distance of a small amount of parenchyma between the wall and the cyst, and I hope that it will increase the stability. The aim of this procedure is to ensure a permanent drainage towards the GI tract. So I will place stent which will stay in place for years in this lady. So we will now pass the cystotome, then we will dilate at 6 millimeter, and I will place side by side two 7 French 7 centimeter stents. Okay, you see the cystotome which is coming out, so I apply pure cutting on the cystotome. Okay, now I'm inside.
That's good, that's the current.
No,
so then
no, I'm inside.
And now you're inside.
So if you see the US there, this is, we came back to the guidance of the US, so no, we will leave the wire inside, remove the cystotome, and do the dilation with a 6 millimeter balloon. So you see that I will advance the balloon up to the cavity. Flo, please. To be sure that I will dilate the wall at the entrance of the collection. You can dilate now. That's 4 centimeters, but you see that we have a significant amount of tissue in between, so I will have to dilate 2 times. So now we can deflate, we have no imprint. I will pull back the balloon to see it endoscopically. Now we have a very nice view, and then we will deflate the balloon, remove the balloon. We will place the 10 French sheet of the cystotome to place a second wire, and then we will place 2 stents side by side. So this stent will go through the wall of the GI tract and through the pancreatic parenchyma and to the cyst, and I'm quite sure that we will, by that position, increase the stability of the stent. We are at effect 8.
Yeah.
Mm-hmm. Yeah.
No, we must definitely, yes, now it's going better. Now we are inside.
Excellent.
So it's good.
X-ray,
So
please.
now we will place a second wire there. Okay, this is the second wire. This is a jag wire.
Yeah.
So you can push the wire, make a turn. Then we will be completely on the safe side. We have a stent which is already placed on the second wire. And I'm pushing very gently the stent up to the time I will see the black marker. You see that the distal pigtail is already inside. This is the distal marker. When I see the distal marker, I will ask Ute to remove the wire all the way. Then I put my endoscope a little bit at a distance, and then we have the first pigtail, and this will be the same for the second one.
So, Jacques, this
Yes.
was a very excellent step-by-step teaching of this challenging situation, which you managed in a fantastic way, as we have expected. Thank you so much.
Thank you very much. Thank you very much.